Suresh Kumar is back with us. He's the medical director of LNJP Hospital and he's telling us about the first case in Delhi that is currently being treated by him. Sir, glad to have you back. So we were talking about that patient. Now, sir, what are the identifying symptoms that anyone listening to you right now needs to know that if that is a symptom that their body is reacting, they need to immediately contact the doctor? And is it infectious, sir?
Yes, it's infectious. If you have any patient with history of fever and skin rash, and if you have a history of international travel or any travel in the high risk area, number one, if you have the symptoms of fever with body ache, with skin rashes, typical vesiculopustular rashes and painful rashes in the skin, then one must go to the doctor, and as a part of physician and the dermatology team, we recommend that all these suspected cases must be tested for the virus. And we have, in this case also, we have sent the sample from the skin lesions and the blood test to the reference laboratory, and we got the positive report. So this is very important to identify the symptoms, and if patient have typical skin lesions, then one must be having high grade of suspicion on all these cases.
So any sort of rash, any sort of inflammation, they need to suddenly have that caution about. Sir, because your audio is back again, sir, if I can go back to the patient that you're currently treating, and if you can give us a few quick details yet again, that this is not about a foreign travel, there were skin rashes, and now the individual is being treated at the hospital.
It is currently vitals are stable. He is recovering. He had history of fever 10 days back, and then he's the skin eruptions over the last 1 week. And now the patient is doing very well, and nothing to panic, because the more information about the transmission, about the disease, about the clinical spectrums, the method of diagnosis, how it's tested. So that these are all important parameters that everybody must know, and how to protect healthcare workers and all the team, and at the same time how the general public can be more aware about the monkeypox virus, and what are the protective mechanism, what are the precautions that one must take. It is very important to know that it is a droplet transmitted virus, DNA virus, different from the COVID virus, and this spreads from human to human, and we have to wear the mask, and it is very important that we must observe this social distancing, and we must not share the bed sheets, clothes, patients, the close family contact should be avoided if patients have skin lesions and patients have fever, conjunctivitis, and typical features of monkeypox.
How is it different from the coronavirus? Because it's important to understand that we must continue to take similar precautions which Indians are used to now for 2 years. But what can they add to, sir, to ensure that they do not catch the monkeypox as well?
See, the coronavirus is a RNA virus.
Yes.
This virus is different. It is a DNA virus. It primarily involves the skin. And there is no hypoxia or lack of oxygen, or you don't require any ventilatory support or oxygen support in monkeypox virus. In the COVID, we have seen that majority of these patients have cough, sore throat, low oxygen, typical COVID pneumonia, SARI-like symptoms. Here you have primarily the fever and skin problem, and then you have the conjunctivitis, you have the headache, and you have typical skin lesions which are resembling the chicken pox like eruptions in the skin, and there is a crust formation in the skin, and you have hyperpigmentation, you have umbilicated lesions, and the lesions are mainly over the face, trunk, legs, and on the palms also, which is differentiate from other viral illnesses. So typical classical vesicopustular lesion in the skin differentiated from other viral disease, and it hardly involves the lung.
That's very important.
Lungs are only involved in the immunocompromised patient.
What you're telling us, these are details that our viewers really need to know.